You're listening to the OCD Stories podcast, hosted by me, Stuart Ralph. The OCD Stories is a podcast dedicated to raising awareness and understanding around obsessive-compulsive symptoms. I do this through interviewing inspired therapists, psychologists, and people who have experienced OCD. Welcome to the OCD Stories. And welcome to episode 455 of the podcast. And in this one, I got on Elena Fasan. Elena is a licensed clinical social worker and founder of the Children's OCD and Anxiety Collective. We discuss her OCD story, how OCD can affect a child's development, getting creative with kids in OCD therapy, working with parents, supporting siblings, and much more. And thank you to NoCD for supporting the podcast. NoCD offers effective and convenient therapy available in the US and outside the US. To find out more about NoCD, their therapy plans, if they currently take your insurance, or to download their free app, head to go.treatmyocd.com/the OCD stories, or the link will be in the episode description. Thank you to all of our patrons for supporting our work. To sign up to our Patreon and to check out the other benefits you'll receive as a patron, please see the link in the show notes. So thank you to Elena for her time and expertise. It was a pleasure chatting with her. Of course, thank you to you guys, as always, for listening. It really means a lot. And without further ado, here is Elena. Welcome to the podcast, Elena.
Thank you so much for having me.
Yeah, it's good to have you on. And I met you at the awards night of the ISTF conference recently.
Yes, that was fun.
Yeah, did you enjoy the conference?
I did. I had a great time. I was really privileged to be one of the youth leaders. So I got to be with the teens every day, and It was awesome. I had a great time. Did you have a good time?
Yeah, it's really good. Yeah, always nice to catch up with everyone and meet new people and obviously see the talks. So,
yeah,
really
it's pretty awesome. Yeah.
Awesome. So, before we get into today's topic, which will be more focused on kids, just maybe a little bit about your story, just anything you want to share. Actually, before that, who are you in terms of training and...
Yes. Okay. So, my name is Elena Fasan and I live in Los Angeles. So after grad school, I found, Dr. John Piacentini at a conference, and I just kind of went up to him. I'm very bold and did this whole spiel and was like, I love your research from this to this to this to this. And he was just like, who are you? Like, what? Who are you? And why are you so bold? And then he introduced me to, at the time, Michelle Rosenman, who was the associate director of UCLA's pediatric OCD intensive outpatient treatment program for teens and kids. And I interviewed there and then trained there for 16 months. And then I was hired at the OCD Center of Los Angeles, where I worked for about 7 years. And then I started my own practice, the Children's OCD and Anxiety Collective, in January of 2023.
Nice.
And then also in terms of my background, I spent many years as a performing artist. And I fell into being a nanny. So I nannied for 17 years. It was better, at least for me, than food service on the side of being a performing artist. And that was really what sparked my interest in working with kids, because I just really loved being a nanny. I loved it.
Awesome. Do you ever see any of the kids you used to nanny?
Oh, yeah. I am very close to two different families, but a 29-year-old, a 22-year-old, a 17-year-old. The 17-year-old, during the school year, I pick them up on Fridays and take them home, often hang out a little bit. The 29-year-old they text a couple of months ago and said, do you want to go to Inside Out 2 with me? And I said, yes, of course I do. You know, I'm going to cry. And, which they knew I was going to cry, but yes, we're very close. The youngest, the 17-year-old I've known since they were about a week old. Wow. And they used to call me, the other mother. which I proudly took that name. And, it was a lot of learning about family systems and parenting. And I was raised by academics, so I tend to read as much as I can voraciously about whatever it is I'm doing or trying to learn about. So, when I was in drama school, I was reading every play and every acting book I could get my hands on. So while I was nannying, I was also studying. I went back to school. I had a drama degree, but I was studying child development in the morning, going to class, and then going home and watching basically how some of these developmental theorists underestimated babies and children and watching it, play out. And yeah, it was an incredible experience to be nannying and learning about it at the same time. So learning about kids. Yeah.
That's awesome. Yeah, thank you for sharing that. And yeah, like you're saying, you were doing child development studies and then going and watching them basically. That was actually a part of my course, initially infant observation.
Oh, wow.
Which I had to do weekly, and then I did a family observation in the final year. And you learn so much just by watching them interact.
Yeah, and actually they're really good. As little ones are very good mindfulness coaches. You really have to be mindful and in the moment with them and just here and now. But also, they feel what they're feeling, they express it, and then they move on. They're very present moment focused. So I liked that aspect. Yeah.
That's a really good point. Yeah. All right. Awesome. And then you have an OCD story. So I'm sure a lot of it will be weaved in and come up with the questions I've got for you. But yeah, anything you want to say that's important to lay out?
Sure. So I had very early childhood onset. I remember doing compulsions, elaborate rituals around age 4. So I had a very elaborate ritual with the toilet flushing. I had to get down the stairs from the upstairs where the bathroom was, the main bathroom, and go down the stairs in a pattern and then touch these 2 lamps in a specific pattern. And I had to do all that before the toilet stopped running, that sound after you flush. And it kind of butted up against my father's OCD because he was worried always about money. And so to him, I think he even had a sign on the toilet for a while that said, jiggle the handle, because he didn't want the toilet running because, that would be expensive, which, not the most rational thing. I also remember I was an early reader. Every new word I learned, I felt like I had to write it with my finger in between my front 4 teeth and make it perfectly symmetrical. I'll never forget when I learned the word really, REALLY. I really got caught up on that, it kind of being lopsided with the L's on one, and just really that messing with me. So I have those memories from very early onset. When it really started to get severe for me was right around puberty. So around 11, I was a little bit of an early developer and I was having massive OCD tantrums at that time. I'm a Gen Xer, so this was during a time where OCD itself wasn't very well understood and certainly not in children. So my 6th grade year of school, that December, I was cast as the lead in the school musical. And I was also performing with the ballet company in the city where I lived. I was a pretty serious ballet dancer. And so I was in the Nutcracker, which they're for regional ballet companies, that's their moneymaker for the entire year. There's a lot of performances. And it was just too much for me. It was, I was definitely a kid with moral scrupulosity and really a lot of perfectionism. And I loved performing, but it was just a lot for me. And I was melting down one day. I was supposed to be at the theater for the Nutcracker, and I was just having a complete tantrum. And my grandfather had come to town unbeknownst to me. My parents had decided that I needed a higher level of care. I wasn't in treatment at the time. The evidence-based treatment that we have now was sort of still being developed. I lived in Omaha, Nebraska. There wasn't anybody there who treated OCD. My parents then took me to the hospital. And so that was my first residential stay at age 11. I then had 3 more stays, twice at 16, once at 17. And I also had 2 suicide attempts because I was just completely overwhelmed by OCD symptoms. There was a lot of comorbid depression. I had a lot of violent images with fear of harm that really upset me. The family I was raised in, pacifism and being a good person, taking care of others was really strong value in that family. So of course my OCD attacked me in terms of fear of harm and moral scrupulosity because those were such important values in our family. From what I remember, that first hospitalization was probably a good 3 months. They didn't have a bed for me on the children's unit, so they put me in the locked children's unit, which was a little bit scary.
Yeah.
But it was also a healing place for me. It was a safe place. I made my first male friend in the hospital. I actually had my first very chaste, but my first peck on the lips with a boy in the hospital. So, it was a mixed bag, but I did kind of learn to internalize it at a very young age, partly because I didn't want to go back to the hospital. Things kind of kept escalating. And then finally, I was diagnosed at 19. I was actually diagnosed with a PET scan. So the pictures of my brain kind of looked like the pictures in Brain Lock, like a lot of red, like your brain is on fire. And then my parents, they found me actually through the OCD Foundation. At the time, it wasn't the International OCD Foundation, what we call the IOCDF now. It was just the OCD Foundation. They found me a psychiatrist and moved me from Omaha, Nebraska to Seattle, Washington. My best friend at the time, who had never been there, moved with me to support me. And it was the early 90s, so it was kind of a great time to be in Seattle, to be a young person in Seattle. And that psychiatrist, they found him. He was at the time on the IOCDF's scientific advisory board. And he was the first person who identified mental compulsions, who taught me CBT. And that was kind of the beginning of the road of recovery for me. It took me, a while to really accept the diagnosis. I'm a very hard worker, so I would do the work and then without kind of fully being aware of what I was doing, I would be like, I'm good. Mm-hmm. And then life stressors would happen and it would creep up again. And it wasn't until probably my late 20s or early 30s that I got to a place where it felt like an epiphany, but epiphanies are really all the work that you put in and all the processing. And then you kind of have this light bulb moment where I was taking some classes at a community college I had a drama degree, but I hadn't gone to, a liberal arts school to take, art history and philosophy and all the fun classes. I was, my parents were academics, so I just loved all that. And I was walking across, something had happened. I had a rough day and I called my parents. They were an incredible support for me, never gave up on me, very loving. And my mom talked me down. Well, probably my dad talked me down, to be honest, because my dad and I were very close. My mother and I were too, but my dad, there was just this unspoken understanding because of his own OCD. And he just really knew how to be there with me in it and just very calmly kind of talk me down. Yeah. And then I was walking to my car and I just had this moment where I went, oh, this is never going away. And I need to stay on top of it. And once I kind of had that first really big step with acceptance, it really became easier after that. I met Tom Corboy, who at the time was the founder and director of the OCD Center of Los Angeles. I joined one of his groups. He actually became a mentor to me. He was the one who was kind of saying, Elena, like, you work with kids, you love it. We need people who work with kids. Like, you should do this. And he gave me a scholarship when he was sponsoring the TLC Foundation for BFRB's conference, and then the IOCDF conference that year in Los Angeles, because I was, a starving artist. Well, I wasn't starving. I was paycheck to paycheck, commercial to commercial artist. And that's where I met Dr. Piacentini, and, I was off from there. So, yeah.
That's amazing. Well, thank you for sharing that, and sure. quite some journey. Yeah. And with the early onset, it's not uncommon, obviously, for kids to have some memories at the age of 4. But I mean, I have like 2, and they're like almost like a picture in my mind. Whereas you've described, my memories aren't of OCD, but you described very clear, almost like videos of.
Yes.
Was it? Do you have a lot of memories from that time? And do you think it was just because you were so stuck that it just really ingrained in your brain?
Yeah, that's such a good question. I do have a lot of memories of OCD early. My mom said I was reading around 4, and reading I'm just a really verbal person. I mean, I will be like a pinball going in doorways. Like, unless I'm in a ballet studio or a rehearsal studio or on a stage, like, my visual spatial awareness is like terrible. But I loved reading so much, and it was definitely a place that I could escape. I loved to draw too. So I would, almost, it wasn't compulsive in the sense of like, I have to do this or something bad will happen, but it was a way, I guess it was pretty mindful now that I come to think of it, but it was a way for me to kind of, I don't know if escape is the right word, but get some relief. So I remember when I was reading, I had this very specific compulsion that I had to find the exact middle point of the book or something terrible would happen. For me, aside from like the violent images, a lot of it was like something terrible is going to happen. I don't know what, but it will be terrible, whatever it is. And I was tortured by that because I love to read so much. And then it gets really complicated because do you include the title page? Do I count, the the page with the copyright and all the ISBN number. What do I count? And then I started counting, paragraphs, but then I would count sentences and then words. Once I felt like I found that middle point, then I was like, okay, good. I can read the rest of the book. So yeah, I have a lot of vivid memories. I started skin picking when I got my ears pierced around right before I turned 10. So that was a very common thing for me. It was pretty constant for years. I think I was kind of lucky that it was my ears. I then got more piercings because in the 1980s, piercings weren't as common, but for dancers, that was a way that you could stand out. And so, yeah, I have very vivid memories of early rituals. I have those lamps, actually. I need to get them rewired, but I found them in my parents' closet after my dad passed away, and we were packing my mom up to move her to assisted living. And I was like, my OCD lamps. So I have to get them kind of rewired. They're old, but yeah, I mean.
And you don't tap them anymore?
Nope. Good. I don't. No, I don't.
Yeah. When you look at them, do they, I don't want to say scare you, maybe scare you? Is there something, because I guess some people might be like, I don't even want to see that anymore. Even if I'm better, I just don't. But yeah.
No, I'm proud to see them because I'm proud of my resilience. I'm proud of the work I've done to get to where I am. So I don't, I'm not ashamed of any of it, and I credit a good deal of that to my parents, that they were, I think because they were academics, they were able to find me help. They were able to find the OCD Foundation. And, we're a family of it's all out on the table, maybe even oversharing. We're kind of unusual. I think we were unusual in that way. And maybe not so much today, but, and there was a lot of mental health issues in the extended family. So it just, my parents were very, open about it. And it's not something to be ashamed of. I mean, I definitely had some of that as a kid. It's embarrassing. I definitely internalized a lot of it. So nobody would guess I had OCD. I hid it very well, as a lot of people with OCD, but yeah, I don't look at those, I'm proud to be a part of this community, and I'm proud of the work I've done to get to where I am today.
Nice. Awesome. Yeah, good to hear.
Yeah.
So I want to talk about how OCD affects development in children and teens. Because obviously as we grow up, we go through these developmental windows, and OCD can just really interrupt that. So just, anything you want to say about that? And then even if you want to bring in parts of your own development, that's cool too.
Sure. So, I mean, I think it really depends on the age. And I think it's really important if you work with children that you have some understanding of development. I love that that was part of your training, because that's not always the case, that's part of your training. So I think it depends on the age. And, I could throw in some Erickson and think about kind of, what his goals are at those different ages. So I think for young children, it might, it can mess with their autonomy and their ability to kind of, separate themselves from their parents. I think that it can also mess with, I think for young kids, I probably could have reviewed this. What is it? Industry versus inferiority? Oh no, I think that's middle school. So for young kids, I think autonomy can be a big issue. For middle schoolers, I think maybe it's more about, social development and self-efficacy. If your rituals are outward or obvious, or you're kind of, lost in your own world, then I think it can be really hard to, develop socially. I was really lucky because I just was kind of born with, I don't know, just very social. I'm kind of an introverted extrovert, but that never affected me. As a teenager, I think that one of the ways it can really mess with development is identity formation. And I definitely think that those hospitalizations for me personally messed a little bit with my identity formation in terms of I'm a mental patient, which is what we used to call it back then.
Yeah.
I'm never going to be free from that. I'm crazy. Even though I had a name for it and I knew what was going on, that was really hard for me. I think one of the big things that I saw for myself and that I see sometimes in my young clients is difficulty with individuation. So, for me, I really needed my parents' support past the time. When I grew up, it was very common for kids to leave home at 18, go off to college, start a career at 21. That was kind of, the norm in the world that I grew up in, at least in my microcosm, right? Or maybe like mesosphere, however we want to put it. Throw in a little Bronfenbrenner there. So, I needed their support. Like I would, be late for just a paycheck to paycheck job and get fired. And my parents would have to help me financially. They were very much a part of, my emotional support system. But I think there was a reliance that I had on them that I wouldn't have had if it hadn't been for the OCD and depression. And thankfully, I had a lot of protective factors. They had resources. They, were very educated. They were older when I was born. They were 35 and 45. So they were kind of settled. Even though my dad struggled a lot with, OCD symptoms and, I think other things were going on. He had panic attacks. Sometimes he struggled with some depression. And my mom really helped him, I think, a lot behind the scenes because I don't know what my siblings would say, but I wasn't fully aware of the extent of his OCD. I mean, we knew that if he was at his desk, like, try to leave him alone. He had this big old wall-top desk. And, he was compulsing about things often at his desk, things having to do with money, usually, I think, but probably other things. He kind of, he was born in 1927, so that generation kind of kept it close to the vest.
Yeah.
So for me, and I think for a lot of the young people I see, that individuation piece, I think, can be really hard. I always tell the parents of my clients, OCD hijacks the person, but it also hijacks family systems hugely. And, I feel like it was, not failure to launch, because I dropped out of high school when I was my senior year. So I was 17 my senior year, and I joined a ballet company. I moved out of my parents' house the next year, like right before I turned 18. I was working full time as a professional ballet dancer, but I still really needed a lot of support from them and also from friends. That was a huge protective factor for me as well. I just, have had and continue to have incredible friends. And the ballet studio, to have that place to go to. And, it's very much about focused concentration paired with repetitive practice toward mastery. That was incredible for me and really taught me grit, gave me so much. And I had that community and that family. And, you're working together as a team to put on this ballet. I was dancing in repertory with them 4 times a year by 13. So that was really a safe space for me. I think developmentally too, it delayed my education. I was much later going to college than I think I would have been. And even when I was in college, I would have to, okay, I have to take this semester off. I'm completely overwhelmed. My OCD education was very important in my family, and it really got in there with a lot of checking and a lot of perfectionism. So I would have very late nights doing homework and rechecking. I was a straight A student, but I remember using my dad's typewriter at his desk, because this was before really personal computers were in everyone's homes. And I refused to use whiteout. And so I would be typing and then, make a mistake, rip it out, throw it away, and just do that over and over. And then my dad would come down and go, "What are you doing? You're wasting ink. That's really expensive, and you're wasting paper, and just use the whiteout." So, my father, our OCD kind of butted heads in those moments. So, I'm very determined. I've always been that way. And, just I'm going to do it. And again, I think ballet, it's hard. It's like being an athlete, and it's tedious what you have to do in order to get good. And it's physically painful. I mean, bleeding through point shoes is painful. Yeah. So, it really disrupted me in a lot of ways. And I just had a lot of protective factors that allowed me to function, better than I would have without the family system I was in, without ballet, without, my love of reading and art. And yeah, all that was really helpful.
Yeah, it's really interesting. And I think I see that with my clients too a lot, about this struggle to individuate or separate from the parents, and needing the parents much later into teenhood. Whereas not all, some of my OCD teen clients want to completely get the parents away.
100%.
But equally, it can go the other extreme where they want them by their side all the time. And then, for me, definitely affected my education. Like I as good as failed school and high school. And I remember pretty much the only teacher I liked, he wrote in one of my reports once, he said, Stuart is 1 minute intellectually astute, and the next minute I wonder if his brain's even on this planet. Like, that's what he wrote.
Wow.
And he wasn't being mean, because I really like this. He was just being honest.
Right.
And I was just in my head all the time,
Totally. I found a report from cognitive testing that I barely remember having done when I was a kid. I mean, I was young. I think my sister and I both did it. I was probably maybe 7 or 8. And I found the report when we were going through our parents' stuff, when we were prepping to move them. And it said, Elena is too concerned with adult concerns and seems to be focused on that in a way that is not, helpful. I don't think that's exactly what was said, but that really stood out to me because I was too, I was focused on, am I a good person? Am I, are terrible things going to happen? And I think that was maybe that person kind of reading what they didn't understand as OCD, and I, I think the other thing was treatment back then really made it worse, because it was very, very psychodynamic. And for example, my first hospitalization, my mother was writing her dissertation, towards getting her PhD. And I was the youngest of three. And they somehow convinced me that I had been usurped by my mom's dissertation, and that had taken the place of, that was her new youngest child. And my outbursts were because I was trying to reestablish my dominance as the youngest child. And, there was a lot of inkblot testing and, like a lot of kind of stuff that really made it worse. Like just kind of rumination fodder, really.
Yeah. Yeah. Good way to put it, actually. Yeah.
Yeah.
Yeah. I don't know. I guess
we've come a long way.
Therapy, but like when it's that strict, it's like, oh God, no.
Yeah, I mean, I definitely
held loosely are interesting. As soon as you hold them firmly, it just completely loses the plot.
I totally agree with you. 100%. Yeah, I bring some psychodynamic stuff into my work, and sometimes it's necessary, and I've certainly done some of that work myself. But yeah, it was a different time.
ERP and ACT and whatever else.
Yeah.
It's a different time, like you said. They were doing the best with what they had and what they could, I'm sure.
Absolutely.
Yeah. So, how do you work with kids, and with OCD, obviously, and just any ways you kind of get creative in that approach?
Well, I really like to bring in humor. I think that not most kids and teens will, be open to that. You kind of have to gauge it. Not everybody is going to respond well to that. I'm very into being authoritative, kind but firm. And very collaborative. When I trained at UCLA, that's what they taught us. You kind of hand it over to them. So my goal is to teach them and their parents to be, the kids to be their own CBT coach, and their parents to help them. So I always say, I'm kind of like in the control tower, but you're on the plane. So, you're doing most of the work at home. I'm going to give you some tools. I like to use a lot of metaphors. I say, I'm like Home Depot, I'm going to give you the tools, but how you build the house is up to you. Right.
Yeah.
I definitely love ACT. I bring a lot of that into it. I bring a lot of mindfulness into it. It depends on the developmental age and developmental stage, how I work with them. Definitely with very young children, I do a lot of externalizing. Let's name it. Let's give it a name. Let's draw it. Let's think of it out. Like I'm wanting them to kind of separate themselves from it a little bit.
Yeah.
With older kids and teens, I'm much more, we can notice it and name it, but we're gonna work more on, more ACT tools. I mean, I do ACT across the lifespan, but it's much more about like, let's diffuse it. Let's do some expansion, obviously ERP. Regardless of the age, I'm very much want parents involved because of what we said about it hijacking the family system. With little kids, it's an imperative. Yeah. It's really important with assessment with little kids, and you're probably well aware of this, to determine what's developmentally normative and what's OCD. What's the intention of that behavior? Is that repetitive behavior because that's how you learn as a 5, 6-year-old?
Yeah.
Or is that repetitive behavior because you're trying to prevent something bad from happening? With little kids, I encourage parents to, come up with some kind of reward system for homework completion for me. With little kids, it's easy, man. They'll respond to a sticker chart. They'll get so excited over the smallest little rewards. It's amazing. Also, because they lack autonomy, if the parents are on board and the parents are trained to respond differently, right? They shed the symptoms so quickly. Their brains are so plastic. It's amazing. So I like to have a lot of fun with them. I like to joke around with them. I can definitely be firm. Um, I get a lot of, oh, I didn't have time to do my homework or I forgot. And so I very early on say, nope, those are never going to be explanations for me. And then I will go through and say, this is how much time it would take you. How much time are you on your phone? Right? For older kids. Hopefully my little kids are not on phones. So I think it's really important. I'm kind of jumping around to assess for developmental age, because I've met younger children who already have metacognition and teens who struggle with it, right? I've met really young kids who can sit, I only work online, and can sit for almost the whole session. And then other kids who they're in the session for 15, 20 minutes, they're running in and out, and I'm working with the parent mostly. One of my favorite stories is I had a 5-year-old client who was very excited near Halloween, and she ran out to show me her costume, and she came back in a few minutes later. Her mom and I were just talking about, probably accommodation or something like that. She came in and she had put on her costume with her head through one of the arms of the costume, and we just started laughing. I just think, I don't know why more people don't work with kids, because it's just, it can be so fun. And if the parents are on board and they're supportive and they're doing what I ask, then that can really drive the bus and the kids will follow suit. And, when I did work with adults, because as much as I wanted to specialize with kids and adolescents, there were people at the group practice who needed the kiddo hours. So it wasn't until the pandemic that my boss at the time, Tom, said, okay, Elena, you can just do kids, teens, and emerging adults. I'm like, yes, finally. So, I don't understand, because the adults, it's more ingrained and it takes them longer, right? Where with young people, their brains are still developing. And so, it's not uncommon for me to hear from a kid or a teen, okay, we're going through the hierarchy. Let's work on this. Oh, I don't do that anymore. But we haven't even worked on it. I don't do it anymore. So they generalize much more quickly. So those are kind of the basics of how I work with them.
Yeah, it's really interesting. I agree with that. My younger clients, that sort of pre-10, I've seen the quickest results out of, more so than teens, 18 to 25-year-olds.
Yeah.
Not to say we can't get quick in those other ones, but yeah, kids are just, their brains just mold and bend.
Yeah, really it's amazing.
Quickly. Yeah, exactly. And yeah, like you say, you have to get those parents on board.
Yes.
Yeah.
And they're doing the best they can. I mean, that's something that I've definitely learned about parenting. It was such an education being a nanny and watching parents. I learned so much from the parents I worked with. I'm still close to some of those parents. And, they're doing the best they can. I believe that's true of all parents, and being a nanny, you really get an education about how hard it is. It's a very challenging job. It's a very exhausting job. It's a very tedious job. And, I did do space training, and, you know, I love the part of the training being, they're hardwired, whether the danger is real or perceived, to signal to you that they're in danger. And you're hardwired as parents to rescue them. So a lot of what we're asking them to do is counterintuitive. You know, I just had a parent recently, a kid with separation anxiety who is, it's a big struggle to get them to school. And the parents are concerned, are we harming her, by forcing her basically to go to school and, having to say, no, I mean, it's helpful. It may feel to them like they're harming. So that psychoeducation piece is really, really important. It's, we really have to educate parents and families and children, our clients, about, what's going on here, because it is kind of counterintuitive, you know?
Absolutely, very much so. Yeah, and is space something you use in its like purest form as like a structured? 'Cause I'm sure you integrate the principles.
I definitely have had space clients where I'm just working with the parents and I go through, the protocol, but it's commonly more me just integrating it. And I've done things like the supportive statements. I encourage clients to use those statements. That idea of we're going to pair acceptance with confidence, acceptance of the emotion, confidence that we can handle it. So I teach clients to say, I am feeling very anxious right now, or I am feeling very overwhelmed, and I can handle that feeling. Yeah. I can tolerate feeling that way. And I say, even if you don't believe it, just say it. So that's one way I incorporate it. I mean, I like space a lot.
Yeah, that's a real. I've never thought I do space, integrate it, and then I have the odd client which is purely space. I've never thought about taking those supportive statements and using it with my clients directly. That's really.
You can steal that from me.
Oh yeah, I'll take it. Yeah.
I'll
edit this bit out so people think it's my idea. No.
I mean, I do that a lot. Like, there's this really great book called Sitting Still Like a Frog. Do you know that book?
I don't know it.
I learned about that book from told me about that. I think it was years ago. Kimberly Quinlan told me about that book. And it's Sitting Still Like a Frog, mindfulness exercise for children and their parents. And it comes with a CD, or you can just do the audio. It's Shambhala Publishers, I think, and they have the audio. It's a great little book. And they have a chapter about how emotions are like the weather. So I came up with this idea of getting like a paper plate and then a little clip, and having the kid either draw or cut out pictures from magazines of different types of weather to represent different emotions. And then you can do that throughout the day. So like, before we go to school, we're going to do one arm, how I feel right now, and then, or hand, I guess, of the clock. And then the other hand where I think how I'm going to feel later. I'm going to, guess. And then you do that a couple times a day, and it teaches emotional literacy, but it also teaches, they may be anxious. Let's go put this on the clock. How are you going to feel later? And they may say, I'm going to feel the same. Right. And then you go back later and it's like, oh no, actually, I don't feel that way anymore. So I like taking what I've learned and adapting it.
Yeah, that's a really good idea. Yeah, because then it helped them see, oh, it changed. Right,
yeah.
Yeah, I like that. And then is there anything else you want to say on family, not accommodation, family systems?
Oh, yeah. I mean, I think that siblings are not, I think siblings need more help and support. I think, we're getting there, But I remember even recently, my sister and I were talking about something, and I was talking about, you know how it is this time of year when you work with young people, we're slow down in the summer and then back to school. Even if kids are excited about going back to school, it's like, their symptoms spike. And I was talking to my sister about that. And I said something like, yeah, changes and transitions are really hard for people with OCD. And even if they're positive. And she said, oh, yeah, I remember like every holiday, every birthday, Christmas, birthdays, Elena's going to ruin this. She's going to freak out. And my sister and I are very close. So we just kind of laughed about it. I was like, oh, I'm sorry, and she's like, no, you couldn't help it. You were a kid. So I think that, my OCD tantrums would kind of make my siblings walk on eggshells and view me as a drama queen. And don't get me wrong, there are definitely parts of me that are a drama queen. I was a huge performer. I loved it. And even when I was teaching, I taught child development at my alma mater for several years before the pandemic. And that the only reason I started teaching, I kept getting offered the class by my adolescent development class by a mentor of mine who became department chair. He was a mentor in undergrad. I went back to school late to study child development and get my second degree because I was, out there being a performing artist. And I kept saying no. And then I told my parents I said no, and they were horrified as academics. What? Somebody offered you a teaching position at a university and you said no 3 times? What are you doing? And my mom finally said, I said, I don't think he's going to ask me anymore. I've turned it down 3 times. And my mom said, Elena, this is your chance to perform in front of a captive audience. And I went, what? So I took the job. But yeah, I think that it really affected the peace in the home. I think that everybody was probably walking on eggshells. When is Elena going to explode? They didn't understand that it was related to mental health issues. It was maybe perceived as I was just being a brat, and I think it probably sucked a lot of attention away from them because my parents were trying to manage my behavior and manage me. I would imagine that there was a lot more peace in the house when I was hospitalized. That was probably a nice respite for my siblings and my parents. I think there was a lot of disruption, like I said, at night. When I was quite young, I had a terrible fear of being sucked into a black hole. Like there was a trap door under my bed and it would suck me into like a black hole of nothingness. I had a repetitive OCD nightmare where everything had to be symmetrical and I was like trapped. And it was, I can vividly still see it. I could explain the whole thing, but we don't have time. And I think that, so I was afraid to step out of my bed to like go get my parents. So I would just scream until they would come into my room. Finally, they had the brilliant idea to have someone build a loft bed. So I could just like look down and see there was nothing there. Total accommodation, but it was helpful. Yeah. Except when I was, wake up late and I pop out of bed and we had one of those rippled ceilings. I'd scrape my forehead on the ceiling.
Oh yeah. I've done that before.
Yeah.
Yeah. Gosh. Wow. No, you're right. I think siblings can sometimes be forgotten, and that's just the parents' occupation. It's just so obviously preoccupied, and but yeah, I think it's important as parents listening, and as therapists, we don't forget the siblings as well.
Yeah, absolutely. And it can be little things. It could just be, hey, we know this is really hard for you. We recognize that this is hard. what can we do to help you? Or special time, you know, like my mom did a really good job with that. She would occasionally take us individually on separate days. Like, we're going to just have a day where you don't go to school and we're going to go out to lunch, and don't tell your father, but we might do a little bit of shopping. We're going to hide it in the trunk of the car so he doesn't know because he'd be worried about money. Yeah. But, yeah, just finding ways to just kind of, we get that this is hard, and teaching them to depersonalize from it. I think that's really important.
Yeah, really good points. So just changing, well, actually, is there anything else you wanted to say on this topic?
No, not off the top of my head.
No, it's really, really interesting. And so you've got a billboard. What do you want written on that billboard?
Oh, wow. I knew this was coming and I didn't think about it. Oh, okay. So when I was a kid, my dad had this kind of booming voice, but he had a phrase he would say to me all the time in a lot of different situations. If I was very excited, or if I was melting down, or if I was rushing, or if I was, overwhelmed by schoolwork, my dad would say in a very calm voice, "Slow down, Guy, slow down." And I, to this day, hear that in my head, even though he's no longer with us. I still hear that all the time. And I think that's what I would say, because it's so applicable to so many different situations. Yeah. And, Guy for him was his term for like a cute little thing. So it was also like, he would always say, "Oh, look at that cute little guy." Like, he loved cute animals and cute children. And so for him, that was a term of endearment. Yeah. So I like that idea of a billboard telling people, especially if it's, near a freeway, "Slow down, Guy, slow down."
Yeah. Yeah, I like that. Mm-hmm. Yeah, that's nice.
What's yours?
No, don't ask me that. Mine changes. Okay. Mine
I'm
changes.
Sure it does.
Every time someone's asked me it. It usually comes back to something about kindness or love, and it always feels really cliche. But I think really there's not much more to it.
No, I think that's everything. I think that absolutely self-compassion, love, mindfulness, that's all really important.
Let me think. Okay. All right. If you could pick up the phone and call 4-year-old you, what do you tell her?
Wow. That is such a good question. I would say to 4-year-old Elena, you are so strong and resilient and loving, and you are going to be okay. You are going to help people. You are going to make mom and dad so proud. You are going to get through this, and you are going to survive this, and even maybe be a better person because of it. I know that's not always popular, and I don't mean to be a Pollyanna, and I'm not saying it's a superpower or any of that. I'm just saying I don't know that I would have the same capacity for joy. Yeah. I don't know that I would have the same empathy if I hadn't gone through what I went through.
100%. And I don't think it's being a Pollyanna. We don't have to agree with everyone. We still have to appreciate their right to have that opinion. So if people don't agree with what you've said, then they don't have to. They can discard it. And that's what I always say about my podcast. You don't have to like everything every guest says or I says. Just take what works for you and discard the rest. Don't waste any time on it if it doesn't help you.
I totally agree with that. I totally agree with that. And, I do sometimes talk to 4-year-old Elena, and often I'm like, I got you. I know you feel scared right now, but I got you.
Yeah.
I'm here.
Yeah, I think that compassionate inner child stuff's really important at times.
I think so.
Yeah. Look, thank you so much for coming on and sharing your story and expertise. I really appreciate it.
Oh, thank you so much for having me. I really enjoyed talking to you. Thank you so much.
Thank you for listening to this week's podcast. And thank you to our Patreons who helped make this episode possible. And if you would like to find out more about Patreon and the rewards and benefits, then there will be a link in the episode description. If you enjoy the OCD Stories podcast and would like to support us, please subscribe and rate the show wherever you listen to the podcast. And thank you to NoCD for supporting our work. If you want to find out more about NoCD, head to go.treatmyocd.com/the OCD Stories or click the link in the episode description. And quick disclaimer, guys, this podcast is not therapy. It is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care.